just like to respectfully disagree with Dane on the case definition issue. You talk about state of the knowledge of the science, but it's a catch-22. That's kind of circular logic, because we won't fix the state of the knowledge, or state of the science won't progress as long as we are being held back by 20-year-old definitions like Fukuda and by absolute erroneous definitions like Oxford, which really only asks for 6 months of disabling fatigue. That's not a neuroimmune disease. That's a condition of fatigue. So it's almost like playing word games when you say, you know, it has to reflect the state of the knowledge. It never will until CDC takes a stance and says the state of the knowledge, the Fukuda and Oxford have seen their day. They have to be retired. We have a Canadian consensus criteria that more aptly recognizes and diagnoses and describes this disease.
I don't disagree that the older definitions are limited and that we do need something that's more updated. But the idea of this, I was just going from the spirit of CME. What the CME does is tell you what's available, tell you what's out there, tries to educate providers of what is currently available. It does list all of and they can dig further and make their decisions.
But educating the doctors is what frightens us as patients and patient advocates, because how are you educating doctors if you're educating them with outdated and erroneous information like 20-year-old definitions like Fukuda or erroneous definitions like Oxford that puts patient groups together that have nothing to do with each other? That's not really educating, that's miseducating doctors.
Okay, Ken?
Permit me to once again express my ignorance, but let me put forward some things that could be shot down. My recollection is that there was a Fukuda definition, but what is currently under discussion is Fukuda et al., I think it's 1994, which I believe is a CDC modification of the original Fukuda case definition.
Beth, you want to comment on that?
The 1994 case definition is first authored by Fukuda, and that's the definition that it's not been changed since 1994.
Okay, but that was a modification of the original.
That's a modification of the 1988 case definition that was first authored by Holmes et al.
Okay. Right, correct. Okay, but that definition, so shoot me down again, that definition was really meant to be a research case definition. Is that correct?
Yes, that is correct. And clinicians recognize the limitations of a research case definition, but they use it to guide their approach to the patients. So it has been widely used in clinical settings.
But on the CDC website for the relatively new physician, is that distinction clear?
I think.
If it's not, we should.
Yeah.
Okay.
Sorry to interrupt you. When we do a study, you have to describe what definition you used.
That is correct, and that's one of my points, is that the Fukuda et al. 1994 was really, at least originally, meant to be a research case definition, and I believe, and strike me down again if I'm wrong, that what you are putting up on your website should really be a case definition for clinical diagnosis.
And it is used, we describe it as how it came about, and we say that it is used clinically.
Correct, but the Canadian case definition, if I understand it correctly, was really meant to address the difference or difficulties between having a research case definition and a clinical case definition.
Yeah, that was its intention, and but I think it does some additional things that are really important that the Fukuda does not specifically point out, and specifically in the area of the autonomic nervous system, which Fukuda is kind of light on. And so pointing out these things has been really helpful, and I think that is why we have done the multi-site clinical study to expand the data collection on those domains of illnesses that were pointed out very clearly in the Canadian case definition. In our discussions with clinicians, there are clinicians that are very intimidated and frightened by the complexity of the Canadian case definition. So we are both, one, trying to get primary care physicians that the majority of CFS patients encounter first to be conversant with the basics of what this illness is, what they can do about it, and that we don't want to frighten people away from caring for patients with CFS. If it comes down to that we have to have a very, very complex case definition, then that's where we'll get. But we're just at this beginning point.
Okay, but in terms of the website and the discussion that is before this group now, I think it would be helpful if there was at least some clarification or indication as to why there are at least these two definitions, and perhaps the discussion could be limited to just these two case definitions on the website for clinical diagnostic purposes.
I don't have the website memorized. I'll have to look at how we describe these, the multiple case definitions. But our point, our intention is to give basic guidance.
Yeah. Okay. So that would be that's just a suggestion.
Okay. We've got about 5 minutes left for this discussion. Several people want to talk.
Okay.
Ken, Eileen first, and then we'll move through. Please be succinct. We've got about 5 minutes left before we need to move on.
I appreciate Dr. Unger's concern for physician and physician education, but physicians are very intelligent, and I have complete confidence that they can understand a complex case definition. After all, if patients can understand and cope with a complex disease, they deserve to have a definition that truly describes them, and without the consideration first that perhaps maybe this will be hard on the physicians. This is a disease that's hard on the patients. Let's remember that first and foremost.
Steve's next, and then Dane.
Yeah, what's interesting to me is that I agree with Eileen that we ought to take it up a notch to the level that the physicians get it, because if I'm a primary care doctor and I look at this and I'm going to think, oh my God, there's so much going on, what am I going to do? I'm going to find somebody who's more expert than I am to help, and maybe that's part of the message that has to be delivered. So a thought.
Dane.
I think this is an excellent suggestion, because it's such in the spirit of education. And I think we lose sight over time that the 94 case definition was intended for research, and it's a checklist, and it doesn't include severity components. And if that was made clear, that is really important for physicians to understand, and then they can turn to the Canadian case definition and see how much more it describes the severity of the illness and how much more they could use that in their own clinical practice.
We're going to finish this up now. Oh, do you have a
Can I
comment?
say,
Yeah,
just
Herman,
very
sure,
quickly,
please.
I just
Please,
wanted
yes, absolutely. I'm sorry.
I just
you need
want
to respond.
And then it's not a response. This is just a comment. I just wanted to remind the committee that last meeting that we had, the committee made a recommendation that HHS set up a workshop to look at the case definition issue, and specifically for diagnostic purposes. In the data that we're collecting from the multi-site clinic studies, we hope will fit into that process. And I'm sure a lot of people would recognize the need to revisit the case definition issue, particularly specifically for clinical diagnostic purposes.
Yep.
So we await those discussions and clarifications.
But that's been the problem. And we did think that for a working definition, the primer was very useful and a place to start. That belies the use of either the Fukuda or the Oxford or any of the other ones. And we also had requested at some point whether it would be possible to link to the primer so people could see it. And that's an issue with IACFS, and that was going to be worked out perhaps, but that would be a much better way to help somebody because that's a pretty extensive piece. And if somebody's going to take on one of the patients, I'd rather have them satisfy their curiosity with a document that is pretty solid for current knowledge and then decide whether they want to refer them out or find an expert. But anyway.
Okay. Yeah, go ahead.
Just to remind you, we, the healthcare no.
It's on
guidelines.gov.
It
is linked there.
But if it's on guidelines.gov, does that mean that now the CDC could link to it because it's on guidelines.gov and go see it there?
It does.
That'd be great.
That would be very useful.
Unless CDC has some specific
Reason not.
prescription. I don't know their rules of their website,
Okay.
but we can,
We need to draw this part of this to a close. So